My name is Jaime Viramontes, and this is my research project for my Introduction to Psychology class. The subject today being on bulimia nervosa, which is an emotional disorder that is brought on by obsession over body image, amongst other things, such as underlying causes that can be referred to in other DSM criteria that we'll discuss in a moment. Some things that are brought on by this disease consist of vomiting, purging, and fasting. That usually cause enamel damage to the teeth and some other gastrointestinal diseases that can be brought on by it, as well as severe emaciation and heart arrhythmia that can occur from low hypothalamic activity, which is referring to hormones, of course. Genetic epidemiology, referred to by the American Psychological Association, we refer to comorbidity, the combination of two diseases. When we refer to anorexia, we can refer to an overlying cause, and the underlying cause usually being the bulimia. According to Kenneth S. Candler and Associates, as referred to in the American Journal of Psychiatry, using this DSM criteria in 1991, which kind of makes it a classical study, refers to low paternal care, sexual abuse, a slim ideal body image, external locus of control, history of weight fluctuation or frequent exercise, low self-esteem, and high levels of neuroticism to add on top of that. And this disease has been found in 1 in 25 women, or has affected 1 in 25 women, in reference to the American Psychological Association as of 2016, and has been in the past as observed by psychologists. In the etiology of this disease, we can observe the depressive symptoms of bulimia nervosa. In another classical study by the Royal College of Psychiatrists provided information of these standardized measures to conclude that the often primary feeling of anxiety becomes the obsession. When this obsession becomes primary and focused to the subject, what was once that feeling now becomes the condition, and that condition is majorly known as major depressive disorder. Some of the effects were little known in the short-term effects of this disease, but as observed in the long-term effects through history, we see several ideologies and treatments that are used to the severity of the disease that occurs with the subject. When referring to Christopher G. Fairburn and his associates in the Archive of General Psychology in 1995, we observed that cognitive behavioral therapy tends to leave better results than just behavioral therapy by itself, which leave less profound results in the subject and have a shorter prognosis. And conducted in their 1993 experiment as well, we see that they chose randomized patients, both adolescents and adults, and over a course of 19 sessions of 18 weeks, they compared the combined treatments, and they saw that the CBT combined with the interpersonal psychotherapy fared much better than just the cognitive behavioral therapy and the behavioral therapy by itself, allowing us to see that a high rate of withdrawal from just those patients with the cognitive behavioral therapy and the BT had up to a 48% withdrawal rate. The CBT and the IPT proved better outcomes. And we can talk about certain temporal variables, difference in your cognition. People have different functions and capabilities, and we can't refer to all of these solutions to just one person. And in the clinical analyses of these people, we cannot generalize so much, but we can observe to the criteria provided by the DSM. According to Theodore Welson and his associates in 2016 in the American Journal of Psychology, they examined whether the tryptophan depletion exhibited that increase in the binge eating behavior and mood irritability that causes these perturbations in serotonin activity, which what they observed to be the cause of the disorder in eating. An experiment they collected, and an experiment from the late 1980s to 1999, they collected criteria and they referred to ADHD as one of the underlying causes of bulimia nervosa. They collected some very fascinating data that led us to observe that most people with ADHD did, as a matter of fact, have substantial amounts of coercion with this disease. It kind of went hand in hand, and it was significant with women, of course, as we can observe in most. A case study that we can observe is a Saskatchewan woman that I saw on a CBC YouTube video. Her name wasn't described, but it was a woman and her husband who had these issues. She had described from 15 to 31 years old, she had an obsession with her body, that they were going on vacation to Hawaii and she wanted to look good in a bikini, so she felt that it would be alright if she lost a little bit of weight. And so she started just eating apples and started losing weight so severely. And it happened to be on the basis of peer pressure. And when we refer to the societal pressures of the nature of this disease, we're talking about body shame, we're talking about issues with self-esteem, we're talking about a lot of things that are in the physical nature of your body, and the pressure of society we can observe to be in this contemporary age, and even with classical studies, but especially this contemporary age, we can see that there is a lot of pressure to look a certain way. If we observe certain pop stars, certain people of influence, of high character volume, we can see that. The Saskatchewan woman, she had decided to go on vacation with her family. She ate a bunch of apples. She was peer pressured. And this was the start of her, the beginning of the manipulation part of it. She began to become a good liar. And she describes meeting her husband and not really letting these symptoms show until, some things are funny, some things are fuzzy, and it begins to affect her relationship, almost causing a divorce, a split between the two, but ultimately realizing that she needs to seek recovery and getting back together with significant others so that they can achieve a happier lifestyle. Results of this disease are extreme emaciation, as we have observed before, the absence of amenorrhea, which is the issue with the menstrual cycle in women. It can even cause loss of fertility, issues, of course, with pregnancy. How is the body going to feed another when it cannot feed itself, is the logic that we can put behind that. Cold intolerance, bloating, constipation, diarrhea, fatigue, fainting, easy bruising, frequent fractures, nerve compression, scalp hair loss, and early satiety, which essentially is early satisfaction. It's easier for you to lay down and not deliberate as much thought into what you're doing and focus in this life. There are other cardiovascular complications, including arrhythmias, that can occur as well as gastrointestinal issues, dermatological issues, neurobiological issues, and as much as these things are damaging, they can be nutritionally rehabilitated. Some of the endocrine issues that are found in this disease, in females, we're talking about the amenorrhea, we're talking about the menstrual cycle and fertility, we're talking about in males, it can be anemia, we're talking hypotension, it can be low testosterone, and osteoporosis, and of course the arrhythmia. This disease itself is very destructive to people, and it definitely has its place in a society and a place in being its own presence, to have pressure built on you with what you're observing externally. And it definitely is one of those things that I felt in my life. When I was around the age of 15, I noticed that I did not like what I looked like, what I felt like. I was weighing in at about 200 pounds. 25% body fat. I was eating very bad, feeling very sluggish, and I decided to lose a bunch of weight. And for the first maybe year and so of that phase of my life, I was definitely in a place of focus on eating the right foods, avoiding certain carbohydrates, and being the best I can physically. Um, it really didn't have too many bad effects on me, other than maybe in terms of my bodily structure. I did face some skeletal issues. I think that was more of a predisposed thing as far as genetics, not necessarily an issue having to do with an eating disorder. But yes, I do identify a little bit with it. I do see its place in society, as we observe all of the glamour, all of the standards that we can try to abide to but not necessarily achieve as people with the resources that we have. So be our fascination with pop culture.